pregnant women go in the same way as the common people outside, and pregnant women sometimes may fall into high risk category when they themselves are already in high risk pregnancy, some like in conditions like hypertension complicating pregnancy, or diabetic complicating pregnancy, or anemia, SLE, so many other heart diseases complicating pregnancy. If they fall into this category of people, that means they themselves are into a high risk pregnancy category, then the chances of them landing into landing into high risk category for COVID are very high. So the signs and symptoms for the pregnant women are also the same as normal common people. For them also, the most frequent or common symptoms would be cold, cough, running nose, fatigue, centralized fatigue, or any kind of other symptoms, as well as as other people. But symptoms do not increase per se for the pregnant women, but sometimes the morbidity may increase 10 to 15% then when compared to other people, the normal non-pregnant people, because in pregnancy it's just pregnancy itself is a state of immunosuppressive state. So for them, if they are if they have already diagnosed as high risk category, they multiply the risk factors, or they increase the chances of morbidity for them. And the mortality rate when compared to other people has not increased per se, because in mortality usually, unless the patient has landed up with severe morbidity, severe highly severe case of COVID, the mortality has remained same. But once the patient has landed up with a severe COVID, mortality increases when compared to the other people, because in pregnancy, as I already told, they are immunosuppressed people, and for them, lungs, if they are in almost a second or third trimester of pregnancy, for them the diaphragm or the entire abdomen will be occupied by the baby, and they'll be pushing some pressure onto the lungs, which compromise their breathing capacity or lung capacity. So ultimately, COVID is ultimately affecting the lungs. So then they cause much pressure onto the lungs, and this factor especially decides the morbidity and mortality of the pregnant women. And second state here is the hypercoagulability state of the pregnancy. That means increased clotting capacity of the blood, which is a bit high when compared to the normal people in pregnant women. So in these people, as the coagulability state tendency is very high, so in COVID also, the deaths are almost due to thromboembolic phenomenon and thrombotic tendency. So that is the reason pregnant women are a bit high risk, a bit. Once they are infected and landed into severe, moderate to severe disease, the chances of mortality are high when compared to other people, because this underlying pathophysiological phenomenon, which is normal for the pregnant women. And as I already told you, symptoms and signs and everything are common as of the common people. And the next question here is how the antenatal care differs, or how to take care in the antenatal period. Once normal pregnant women in these waves, either in first wave or second wave or the third running wave, if they have any medical emergency, it's better to seek the doctor's advice physically, or if they do not have any emergency, or if they are due with a normal routine antenatal checkup, it's better they can withhold that routine antenatal checkup and take online consultations, because now every day every person is in an online consultancy, and so many platforms have come for online consultancy. unless they have due with their very important TIFA scan or early TIFA scan, or any particular blood tests are to be done at particular stage of gestation. If they do not have any of these compulsory factors, it's better to avoid outstations, or avoid visiting hospitals or any other places. If they do not have any of these risk factors, they can stay at home and they can seek advice if needed, SOS through online platforms or telephonic consultation. What if if the woman is pregnant and she becomes she tests positive for the COVID, then then there is no need to worry at all. The symptoms, as I already told, symptoms, signs, and case progression, everything is almost 90 to 95% same as of other people. And that too, in this present situation, the Omicron stays, though the rapid spread is there, morbidity and mortality are very low. So this has given us a much boost for us. And it has reduced fear factor almost to 90 to 95% less. So if they are tested positive for the COVID, they can just stay at home, take the necessary medications, just basic remedies at home, along with paracetamol for tablet and paracetamol for fever, and steam inhalation if they have cold, cough, or anything. If the temperatures are not subsiding for even after 2 or 24 or 48 hours, even after taking medication, it is advisable to take a physical consultation and not by phone consultation in these situations. So because the early treatment would be the best option for this COVID. And even if after taking, if a doctor advises hospital admission, then it's better to get admitted, because the reason here is, in hospital, continuous monitoring will be there, saturation measurements, or blood test evaluation, and necessary medications are given time to time, and the fear factor which we stay at home is reduced to a major extent. And which self-confidence, or somebody factor feel that somebody is taking care of us, gives us a major boost, which helps in the part of which takes a major part in our recovery. So at this time, early prevention also, with necessary medication at proper time, it can decrease our morbidity to a major extent. And then the next frequently asked questions for us, for doctors here, are yes, medications. Medications, they usually ask us, can they take medication, like, we are frequently hearing about the remdesivir nowadays, or monoclonal antibodies, whatever may be the drug. They ask us whether we can take these medications. So my advice here is, if here the question of maternal risk benefit ratio comes. If you are into many a times we try to avoid any kind of drug in first 3 months of pregnancy, that is first trimester, because the first 3 months of pregnancy is the period wherein the baby organogenesis happens. So we try to avoid any drug so that teratogenicity doesn't happen. So we, that from second trimester onwards, the liberty will be there for us to put them on any medication. So from second and third trimester, there is no harm in taking any of these antibodies, anti-monoclonal antibodies or remdesivir. But all these are pandemic drugs which have which have been discovered in the recent times, and they haven't completed their phase 4 or later on trials. But as I said, risk benefit ratio is concerned, it is to save the mother. So we always go for the necessary medication at appropriate time. But with the 2 years of our experience, we haven't noticed noticed any side effects for the baby. For the mothers who have received this remdesivir or any kind of monoclonal antibodies. But when we come to the first trimester, we try to manage the patient as conservative as possible, as I said, because it is a much more organogenesis period to avoid the teratogenicity. But even then, when the pregnant woman is in high risk category, if she requires aggressive management for the COVID in order to save the mother with no proven data, besides, so we go for the whatever may be the antiviral or monoclonal antibody or any kind of antibiotics, any kind of medication in order to save the mother, because we are left with no other option. We can't lose mother by thinking of the baby. So that is the reason we give the option to the patient. We explain all the plus and minus benefits and risk factors with these medications. We ask them to go for it, and we take care of everything. But in patients who have received this kind of medication, we ask them to be in close follow-up with their respective doctors, so that there are so many diagnostics tests and facilities are here with us. So we closely monitor them. We closely get the ultrasounds done, and tumor ultrasounds done, and any the markers done on the mother to find out any abnormality or anomaly is being detected for the baby or not. So that is the reason, as with this much advanced science, there is no harm in receiving any kind of these antiviral drugs or antibiotics or these antibodies at any particular time, if indicated, and if it helps the mother in recovering from this COVID. So here I would like to stress this point again, that if your treating physician feels that any particular drug related to COVID can be given, should be given, then they can take this medication with no fear factor in them, and they can definitely go for closed follow-up and closed fetal monitoring. If necessary, if they find any fetal abnormalities and fetal anomalies, they can choose a better option accordingly on a timely based interval. So that is the reason they can go ahead for all the medications if your treating physician thinks that has to be given. And the next frequently asked question is whether they can take vaccine in pregnancy. So if it is a primary dose or secondary dose, whatever may be the dose, so either it could be a booster dose, they with no doubt they can take the dose from second, and they take the dose in second and third trimester without any doubt. But in first trimester, you please try to avoid as far as possible in the first trimester. Though you have taken, supposing you have taken a first dose of any kind of vaccine now, and you become pregnant in the consequent month, you try to avoid the booster dose till you complete your first trimester. That means first 12 weeks of gestation, because as I said, it's already, it is a 12 weeks is the most organogenesis period of the baby. So we do not want to take any risk, and that these 3 months are very crucial for us. So you defer the booster dose for first 3 months and take the second dose as you immediately complete the first trimester. So if you haven't taken any vaccine at all, then try taking the vaccine from second trimester onwards. And in case, if you are in due course, your delivery is in due in next 2 or 3 weeks, then they may ask us whether they can go for the second dose of booster, or second dose of vaccine or any kind of booster. So what we say is, only you try to avoid any kind of vaccine or any drugs in first trimester of pregnancy. Later on, you can go for either second dose, first dose, or booster dose, whatever you want to have. So, and any kind of vaccine you take, whether it could be Covishield, Covaxin, whatever, all these variants of vaccines are available. You can go for any of these vaccines, which have almost have given a good efficacy as far as so far. So you can choose any of these vaccines. You can choose any of any you can choose in any trimester you want. And this third, and the next question is if whether they can take vaccine if they are feeding. All the breastfeeding women, all the lactating women can take pregnancy and that can take a vaccine without any doubt, because all the vaccine which you take will go to your circulation but do not cross through your breast milk. So if you are protected and if you are getting immunized for the COVID, then it definitely it indirectly helps the baby, because your antibodies will be produced inside your body, and those antibodies will be transmitted through your breast milk uh, for the baby. So it indirectly helps for the baby too. So there is no fear factor that any breastfeeding women shouldn't be taking this vaccine. So my conclusion here would be, if you are pregnant, if you are due with second dose of vaccine, or if you want to go for first dose of vaccine, go for it from second trimester of pregnancy. And you can take even if you are lactating. The next question here is, if in many times they are getting diagnosed incidentally, though they do not have any symptoms, because nowadays it has become a protocol that every woman, not only every woman, every patient who is getting admitted into the hospital should have a negative COVID report. So for delivery also, the same protocol applies. So they are getting, many times what we are seeing now is they are getting incidentally diagnosed with COVID. So because especially in third wave, as the spread is very high, they are getting diagnosed with the COVID, though they do not have, they do not have any symptoms. They do not have even a simple headache, or they didn't record any temperature, or they do not have any cough, cold, they're at least running nose also. So they're getting instantly diagnosed with COVID. So then what they should do? The answer here would be, if you do not have any labor pains, and if you do not have any complications, or or in wherein the delivery should be the delivery can be postponed for at least a week or so, then just wait and watch. Inform your treating doctor that you have turned positive, and get a baseline evaluation of your baby. And if you feel that the baby is all okay, and if the doctor feels that the baby is all okay, and if you are all okay, you wait for your the report to turn negative. And if you do not have any symptoms, then get admitted to the hospital and go for the delivery, whether it is normal labor or C-section. If in case of normal labor, if the pain start, we cannot do anything, but the doctors will be treating you as a COVID positive pregnant, and they will be taking their necessary steps to deliver you at a suitable place, and they'll at a suitable condition and environment, and they'll be taking their own protection measures, and they'll be delivering. So no hospital is refusing to take a case now. So that is the reason. If you turn positive and if your delivery date is very due near, then do not worry. If delivery is mandatory, and if the delivery has to be done, we are doing at any cost. But if you do not have any risk factors, and if the delivery can be postponed for at least a week or so, we are just I'm just asking you to be at home, get yourself isolated, take necessary medication or precautions, and get the test again done after the particular time, and come up with the negative report. Then they solves the problem. And next question here is, so how to take care of the neonate. And so if your delivery is over and the baby is out, then the question of breastfeeding comes. The frequently asked question for us is whether they can handle the baby, whether they can feed the baby, whether the baby has to be put along with the mother or not. So what we suggest is there is no need for the baby to put in a separate room. If you maintain almost 6 meters distance from the mother until the mother turns negative, so the baby can be kept in the same room, and mother can handle the baby with the proper precautions, like sorry, sanitizing herself before touching the baby, and no, the mother can handle the baby, and she can handle the way if she is negative, if she had been negative. And the next here is whether she can feed the baby. Yes, she can definitely feed the baby. She can put a mask on and sanitize her hands, take a baby, and wrap the baby, take into her arms and feed the baby. And after that, put the baby 6 meters away, and then she can stay in the same room. So there is no restriction from our side, no medical fields. All guidelines are COGRA, COGR, WHO has passed strict guidelines that mother should feed the baby. And if you overweigh the benefits are much high when compared to the risk in breastfeeding. So if you do not breastfeed the baby will be landing into hypoglycemia or any kind of all kind of neonatal infections or any other neonatal complications, which risk much high when compared to if you feed the baby. So there are much less risk factors associated with breastfeeding. So we always recommend the mother to breastfeed the baby. And then, so breastfeeding is, you are breastfeeding the baby and you are all fine. And next comes is the follow-up. So every, person asks us when we should come for follow-up, what exactly our precautions are to be taken. So, with this much of clinical cases we have handled of COVID positive pregnancy, and with this much of our past experience with with the first, second, or continue ongoing third wave, what we recommend is to go for high protein diet for all pregnant women, and the pregnant women who turns positive, because this COVID gives us much fatigue, weakness, or excessive tiredness or excessive hunger. These are all the most common symptoms immediately, immediate next period to the COVID. So that is the reason we always ask these particular patients to stick on to high protein rich diet along with rich in vitamin C. So whether these patients are to be provided any specific diet, any kind of protein diet or any kind of specific diets, means there is no such protocol. Whatever you eat, whatever you follow a routine healthy diet in pregnancy can be taken normally, and there is no need to go for any protein shakes or any protein extra powders and all those. So your fresh homely made food is very much enough, along with fresh fruits and foods which contain high protein, iron, calcium, and multivitamins along with vitamin C. So this definitely boosts your immunity and helps you to recover from acute illness. And it definitely gives you a kind of better feeling, so that you get a feeling that you can handle yourself and you can handle your baby, you can handle your pregnancy. So that is a reason we always ask you to go for high protein diet. And next second important point regarding nutrition is, so you got to hydrate yourself with lots of fruit juices, fresh fruit juices, or water, or any kind of coconut water, any kind of good juices or something. So what this hydration does to your body is, it helps in it helps in maintaining your circulation in a smooth manner, and there is less chance of coagulability, and there is less chance of there is much free radical, this immune fighting capacity increases, and you feel much better. And the third point here is, if you have a running nose or any kind of symptoms, you better go for steam inhalation with simple remedies, household remedies, so that you'll have a good relief of your difficult breath, and you can have a measures and timely medication, sticking on to good nutrition, and periodical consultation with your respective doctor, either physically, or if you are not able to attend her physically, over on telephonic and consultations. All platforms are there. So what I suggest is, it is not at all a panic situation to worry at all. So you can utilize each and every platform, online platforms, or any kind of social media, which are educating a lot about the COVID and all. So you can have a normal pregnancy, you can have a normal delivery, you can have a normal postpartum period, and you can handle your baby. There is nothing to worry much about, that this COVID in pregnancy, dangers of pregnant women, and morbidity and mortality are, as 90 to 95% are same as normal common people. So do not worry at all. If any factors or any symptoms are worsening, and if you are not able to handle yourself, or by your caretakers, all hospitals are taking care of this COVID.